Hey, are you a business owner, entrepreneur, or professional? If so, we want you to apply to be a featured guest on our show. My name is Adam Torres, and I host the Mission Matters series of podcasts. I've recorded over 3,000 episodes, and we are just getting started. How do you know if you'd be a good guest to be on the show? Well, only one way to find out, and that's to apply, but I'm going to let you in on a little secret. We want guests that have a story to tell, guests with a brand, a product, or a service that can benefit my audience of listeners. If this sounds like you, go to missionmatters.com and click on Be Our Guest to apply. I'd love to talk to you and get to know more about your story. Again, head on over to missionmatters.com and click on Be Our Guest to apply. All right, now let's get into the show. Hey, I'd like to welcome you to another episode of Mission Matters. My name is Adam Torres. You can follow me on Instagram at AskAdamTorres to keep up with my book releases, book tour schedule, signings, all that other good stuff. Always love to connect with you there. And as always, if you'd like to apply to become a co-author of one of my upcoming books, just head on over to the website, missionmatters.com, and click on Become an Author to apply. All right, so today I have Glenn Krauss on the line. He's creator and founder of Core CDI, and he's also co-founder of Top Gun Audit School. Glenn, welcome to the show.
Yeah, thank you, Adam. Great to be here.
All right, Glenn. So excited to talk to you today about Core CDI, also Top Gun Audit School. So we'll talk about the companies, why you founded them, and some of the challenges and opportunities, I should say, that you're pursuing with the companies. And I guess just to get us started, we'll start with our signature question, if you will. So Glenn, we at Mission Matters, we amplify stories for entrepreneurs, executives, and experts. So that's our mission, Glenn. Glenn, what mission matters to you?
Excellent question, Adam. What mission matters to me is helping a CDI profession, help the physician and providers become more proficient, working smarter, not harder, in documenting and charting an electronic health record. We know that, Adam, for every patient seen, physicians and or providers spend at least 15, 20 minutes of time charting in the records. So it's possible to help physicians work smarter, not harder, and become more proficient in documentation, allowing for more face time with their love of medicine with the patient. We've all been patients. And also helping the physician and the hospital survive in this tough economic financial challenges of the pandemic. After all, healthcare facilities and providers must generate revenue to stay in business and keep their mission of treating patients regardless of their ability to pay.
Fantastic. And really love bringing mission-based entrepreneurs and businesses really on the show to share with my audience. So this is great. And I guess just to go further into this, so tell us a little bit more about Core CDI and why you founded it.
Okay, well, Core CDI, I came up with the name Core CDI because at the core of the clinical revenue cycle and patient care is documentation. And my goal is to work with CDI professionals and make a mark with the CFOs and the revenue cycle directors and so forth on getting back to the roots of the medical record. It's a communication tool first and foremost, and not a reimbursement tool. If we focus on the patient care and the communication of that care effectively through documentation, we are going to achieve a high-performing revenue cycle with optimal revenue. So working on the processes of documentation as opposed to just the outcomes of reimbursement, you're going to have a better return on investment.
So why are current CDI programs not quite so effective?
For a variety of reasons, but the main is we're focusing primarily on a very small part of documentation. That's the diagnoses. That drives CCs and MCC capture, principal diagnosis selection, and coding and reimbursement and case mix index. The piece that's missing that detracts from effectiveness of overall programs is actually changing physician behavior. Sharing with physicians and sharing with physicians and teaching them through learnings and treating them as colleagues and not targets of queries is how best to communicate that patient care, capture the patient severity concisely, consistently, effectively, and capture the patient story, reporting of the patient story, that's supporting their clinical judgment and medical decision making. We will have a lot better documentation, better quality documentation, and more effective documentation that in documentation for optimal net patient revenue. We're just focusing too much on one aspect when we should be thinking encompassingly on improving that documentation.
And so maybe let's go, and you gave us a good overview, by the way, so thank you for that. And maybe let's go just a little bit further into maybe some of the like the core fundamentals that make effective CDI program, like what's needed to kind of enhance it, so to do some of the things that you mentioned regarding revenue streams.
First of all, changing the processes of CDI, not blowing up what we're doing, but building and expanding upon it to make it a more holistic approach to CDI that brings in all the players in the revenue cycle: case management, utilization management, utilization review, physician advisors, the physicians themselves, denials and appeals department. So we really need to break down those silos, because you can't operate just like healthcare doesn't operate in a vacuum, neither should the clinical revenue cycle. And we should change and recognize the urgent need to transform our current processes, build and expand upon them, as I mentioned, because this is what's needed to drive real improvement, as opposed to a current reactive, retrospective, repetitive process of issuing queries that doesn't engage physicians. We have to create a vision that inspires physicians, and that is bringing into the fold the patient. Who benefits from solid and complete documentation? It's the patient. We can't forget the patient in the whole scheme of healthcare.
And so, and just to make sure that I'm understanding this correctly, so you're not trying to reinvent everything. Like you're trying to add some core fundamentals to it that's going to increase the revenue cycle and the experience for everybody, including the patient. So you're building on what's already there.
That's right, absolutely. That's why I came up with the name CORE, because what's core to CDI is the patient and the communication about patient care.
Awesome. Love it. And obviously, I'm not working on that day to day, but you are. And so your vantage point is unique. So why do you think, there's resistance to this type of change in the CDI arena?
I think it's really, answers multi-pronged for that question. There's always going to be some resistance to change, no matter what industry you're in. People are comfortable with their particular roles in CDI, and a lot of them are. The majority of CDI professionals are nurses, and I'm not talking about all CDI professionals. Majority are nurses, and I believe, or I have the sense that the profession, in some instances, treats the CDI profession as a job, not a career, not a calling. So if I come in and do what I've done for a couple, 10, 15 years, 2 years, and it's earning me a paycheck, there's going to be some resistance to change. CDI leadership, the majority of the time, rises up through the ranks. So this is processes that we have in place, all that they know. And the last thing I believe is that the CDI profession is driven by consulting companies, and their best interest is not changing the model of CDI because it works for them. It generates revenue and business leads and need for ongoing consulting. And so you put all those forces together, and you have a resistance to change.
Hmm. Well said. And so, Glenn, so what's next for you and Core CDI and Top Gun Audit School? Like what excites you right now?
Well, what really excites me, Adam, is engaging a following, or at least professionals who see the light, that see the need for change. Something happened a couple of weeks ago. A VP of Revenue Cycle for a large health system in the Midwest reached out to me on my website and asked if I would be willing to talk to them about CDI assessment. So what really enlightened me there and continued my further passion is having that conversation with a VP of Revenue Cycle who understands the CDI model today needs a transformational update. It's not working, and he asked if for a proposal on conducting a CDI assessment to point them in the right direction from a transformation and updating the processes and driving that patient revenue and denials avoidance. So that really was something that enlightened me and continues to drive my passion for this.
Man, that's awesome. I love it, Glenn. So, Glenn, I'll tell you, it has been a pleasure having you on the show today, learning more about you as an entrepreneur and also what you're doing over at Core CDI and Top Gun Audit School. And that being said, if somebody is listening to this right now and they want to learn more, what's the best way for them to follow your work and to connect?
You can go to LinkedIn and under my name, Glenn Krauss. I have a another LinkedIn page called Physician and Documentation Matters. When the Physician Documentation Improvement, a new paradigm, I changed the name. You can email me at glenn.krauss@core-cdi.com or fill out the contact button information at core-cdi.com. Those are the best ways to reach out to me.
Fantastic. Well, Glenn, again, appreciate you coming on the show today. And to the audience, as always, thank you for tuning in. Hope you got a lot of value out of this. Hope you learned a lot. If you did, don't forget, hit that subscribe button. We definitely want you to be a return listener and a return visitor. And Glenn, thanks again for coming on the show. It has been a pleasure.
Yeah, thank you, Adam.